Hello everyone, I am Dr. Santosh Kumar, orthopedic surgeon based in Kolkata, and in our present series we have been preparing various videos about various orthopedic problems so that you can be educated and you can choose, you will be able to choose a correct line for your treatment, you will be able to understand and choose a correct line for your treatment. And along with this, it has been our endeavor to bring the world's best in orthopedic surgery right here in Kolkata. Along with the world's best, we make it the safest and the most affordable for you right here in Kolkata. So today's topic, what we are discussing is about problems of the neck. Basically, this is our neck region. We all know it. Neck is one of the most flexible parts of the body, which connects from the head to the main body, and it's a very flexible part. So our spine, which starts from the base of the skull, that is the base of the skull to the tailbone, it's a chain of 31 bones. It's a chain of 31 bones, one after another, and it provides the encases and provides the space and the stability and protection to the main spinal cord, the spinal cord which goes from neck to the back. And along with this, the spinal cord has every level, at every spinous level, it gives on branches which come out at every level. At the spine. So if there are 31 spine bones, there are 31 nerve roots also. These nerve roots from the neck, they come down to our arms and forearms and hands, and from back they go to our legs. So this is how our neck looks like. It's a chain of 7 bones. The upper part of the spine which forms the neck, it's a chain of 7 bones, and this is how it looks. If you see it from the side, this will look something like this. If you see our head from the side, neck from the side, the cervical spine, that is the spine part of the neck, which is the most flexible part. Now, the cervical spine, which is the upper part of the spine, which forms the neck, is the most flexible part of the spine. By virtue of it, we can turn our head any way, we can look up, down, we can look sideways. So this is the most flexible part of our spine, and basically there are 7 vertebral bones. These bones are joined in front by a jelly-like material called disc, and inside and behind they have other joints and ligaments are there. So if we just look at the spine, it's a cervical spine. It's a chain of 7 bones to start with. First one is known as atlas, second one is known as axis, and the most prominent part which can be felt behind the neck is the 7th vertebra, which is known as the vertebrae prominens. So it's a chain of 7 bones, and these bones are joined in front by jelly-like material called disc, and on the sides by facet joints, and posteriorly by these ligaments. So this spine houses the spinal cord. This is how it looks like, this chain of bones, and at every level one nerve root comes out. At every level one nerve root comes out from the spinal cord, which is the branches of the spinal cord. So if there are 7 vertebral bones, there are 7 nerve roots which are coming out. So if we see, this is what we are seeing from the side. If we see a cross section, that is, if we cut like this and see, it will appear something like this. The front part is the vertebral body. It has got lamina and spinous process, and this canal is known as the spinal canal, and it houses the spinal cord. And these branches which come out from the spinal cord are known as spinal nerve, which go past through the neural foramen. This part is known as the neural foramen. Now the issue that we face in spine throughout the spine, mainly in cervical, that is neck and the back, the jelly several times bulges out. This jelly, which is healthy one, bulges out, it balloons out like this, and it encroaches upon the spinal nerve, it encroaches the neural foramen and pinches the nerve. So this gives rise to excruciating pain, stiffness, and because the nerves come down to our arms, the pain shoots down to the arms. So if you see in a more magnified view, it will appear something like this. This is the jelly which joins the 2 vertebrae together. This is the cross section. So this jelly bulges out and it pinches the nerve root by compressing the neural foramen, and this gives rise to serious pain. So a simplified picture, another simplified picture I will show you. This is a simplified picture. This is the normal. This is the normal disc. This is the normal disc, and this is the nerve root which is coming behind the disc. And in slip disc or disc protrusion, what is commonly known as slip disc, this bulges out and compresses the nerve root. and this gives rise to excruciating pain. This gives rise to excruciating pain. Now this is very common. Many of us have it. Many of us have, our friends have it. Many of our family members have it. So 95% of the times it goes off with time, with passes off with time and some medicines. 95% of the times it gets well with time and medicines. So the preliminary investigation, preliminary imaging that we do is an X-ray. But in X-ray the problem is that we can see only bones. We cannot see the soft tissues. We cannot see those soft tissues such as the disc and the nerve root. They are not seen in X-ray. So we have to do an MRI. Like this is an MRI in which we can see this is a cervical spine neck MRI. This is the upper brain. The one which is above the spine is the brain, and this is the cervical spine MRI. It has got a big disc prolapse at C5 level. Now this part is the spinal cord, the spinal canal, and this can get encroached or compressed from both sides, from front as well as behind. From front the disc compresses it, and from behind it is a ligamentum flavum which gets hypertrophied, which gets thickened, and then it compresses the spinal canal. So this give rise to pain in neck, pain shooting down to arms, and in severe cases it can just encroach upon the spinal cord and causes spondylitic myelopathy. What it means is that the spinal cord starts getting dried up, and that causes spondylitic myelopathy. So this is a serious condition which needs to be operated. Once myelopathy develops, it has to be operated, but myelopathy develops only in 1% of the cases, less than 1% of the cases. 95% of the times all these problems will be treated without surgery, just with medicines. To summarize, this is how the disc looks like. These 7 bones are there. So one after other bones are there, and joining the 2 bones is a jelly-like material called disc. This is a normal disc. The disc degenerates with time, with age, and this is a herniated disc in which it has ballooned out. It is encroaching on the neural foramen. This white part, this is known as the neural foramen. This is the part where the nerve gets out and comes out from the spinal cord. And this is degenerated disc, and this is thinning of disc that we see with degeneration with age. Just to have a recapitulate how the disc bulge compresses on the nerve root. This is how it compresses on the nerve root. It presses the nerve root. So once the nerve roots are pressed, it causes neck pain with severe spasticity. We may have difficulty in turning sideways, looking up and down. And along with this, because the nerve comes down to the arms like this, the nerve comes down to arms like this, the pain also may shoot like this to variable areas. Along with pain, there can be tingling, there can be numbness, there can be burning, all these things can be there. So, and to see this, we have to do an MRI. This is an example of an MRI where there are multiple level disc prolapses there. There is a disc prolapse between C5, C6, there is a disc prolapse in C3, C4. So multiple level disc prolapses are there, and all these things can be made up in MRI. Now, as I told you, 95%, more than 95% of times it can be managed just with medicines. Most of them times it can be managed with medicines, and we have to give some time, and most of the times people get well with time and medicines. But if it is not happening, then we have to do surgery, or else there is conditions like neurodeficit when weakness has appeared. In that case, we have to do surgery. And of course, I mentioned there is something called a condition called cervical spondylitic myelopathy, in which the spinal cord dries out. The spinal cord starts drying out because of the constant pressure in which it is subjected to from all sides. So in that case also we have to do surgery. Most of the times the surgery is from the front, and sometimes it is from the back. Especially in cases of cervical spondylitic myelopathy, it can be from back, when the compression is from back. We see in the MRI whether the compression is from front or from back, and then we go ahead. Mostly it is from the front, so we see it from the front and open it and do the surgery. Most of the times this diseased disc, this affected disc is removed, and it can be, we have 2 options. One is to fuse it, means we removed the diseased disc, we decompress the nerve root, and then we put spacer and filler and we fuse it. This is one option. And second option is we replace it, which is known as disc arthroplasty. We have 2 options. One is that we remove the diseased disc and we fuse with a spacer and a plate, and the second one is we remove the diseased disc and put an artificial disc there, which is known as disc arthroplasty. Putting artificial disc is disc arthroplasty. Now this is how it looks in X-ray. there is anteriorly in this X-ray we have done a fusion. The fusion is being shown at 3 levels. The disc has been removed and a spacer has been put and a plate has been applied. Now the problem with fusion is that because it fuses that segment of the spine, but it doesn't mean that the person will not be able to move his or her neck. Of course the person will be able to move his or her neck, because the movement takes place around 10 and 12 segments. So only if 2 or 3 segments are fused, still movement will take place, but it does restrict the movement. So wherever possible, if it is possible, we go ahead with something called cervical disc arthroplasty. What it means is that we replace the disc with a artificial disc. We replace this disc with a artificial disc. So this is what is known as cervical disc replacement or cervical disc arthroplasty. In this photo we can see the disc material, the diseased disc material has been replaced by a prosthetic and artificial disc, which is known as cervical disc replacement or a disc arthroplasty. So in X-ray we have just compared that in the upper X-rays we have shown that fusion has taken place, in which the diseased disc, which is the jelly between the 2 vertebral bones, has been removed, a cage has been put and a plate has been fixed. So this is known as anterior cervical discectomy and fusion or ACDF. And presently, where possible, if the criteria are satisfied, we go ahead with replacing the disc with an artificial disc material, which is known as disc arthroplasty. Now the advantage of disc arthroplasty is that it doesn't fuse that segment, that particular segment. So it allows movement to take place. That is the advantage. Now this is how a cervical disc arthroplasty looks like. This is how a cervical disc arthroplasty looks like. On upper side there is a titanium plate, and it is coated with calcium hydroxyapatite so that it fuses with bone. It integrates with bone. Both sides there is a plate. In between this is a ultra high molecular weight plastic polyethylene, on which it can the movement takes place, and it has got multiple degrees of movement. It has rotational movement, like rotating our head. There is forward bending and upward bending, which is known as flexion extension. There is lateral bending. So basically it has got multiple levels of movement, multiple axes of movement, and all these movement take place. This is how it looks like. So multiple level movement takes place as compared to fusion, wherein the disc space is fused, as compared to fusion wherein the disc space is fused. So multiple level movements are taking place. Here also multiple level movements are taking place. In X-ray we can see that this replacement, this disc replacement is allowing the movement to take place. Like here the person is looking upwards, so it has allowed the movement to take place. Here the person is looking downwards, so the disc has adjusted according to that. It allows the various level movements to take place. To summarize, what we do in disc replacement, we remove the diseased disc which was impinging upon the nerve root, encroaching the neural foramen and causing severe pain. We have to replace that degenerated disc or a protruded disc with a disc replacement implant, which is known as artificial disc or disc arthroplasty. So this allows movement to take place and takes care of the pain. The person recovers from pain and movement of the neck is preserved. So this is a very effective surgery in people who are suffering from severe radiculopathy, not being cured with medical management, with other criteria which we can discuss in details later on. So in this series, in this video we saw the problems of the neck, which mainly is protrusion of disc. What it does, it causes neck pain, it causes arm pain, and 95% of times it will be cured with time and medicines. We have to give medicines, wait, time, and it will be cured. But if it is not getting cured, 5% of times it will require surgery. The traditional surgery was take out the diseased disc and fuse it. So that is known as anterior cervical discectomy and fusion. And presently we have moved to cervical arthroplasty also. But of course we have to remember that in all cases we cannot do cervical disc arthroplasty. We have to choose selectively, and then only we can do cervical disc arthroplasty. So this is how we treat cervical disc disease. And if you have any further query, you can always WhatsApp me on 9831 911 584 or mail me at santdr@gmail.com. It has been our constant endeavor to provide educative videos of various orthopedic problems so that you can understand and go in a proper line of treatment. And you are most welcome to come here to Kolkata. you are most welcome to come here to Kolkata to get the world class treatment at the most affordable price and enjoy the warm hospitality of Kolkata. So please do come if at all treatment is needed for you. Thank you.